Today, we're breaking down 5 biggest knee pain myths that what science has quietly been telling us for years, because once you understand this, your knee pain starts to make a lot more sense. Let me guess, your knee hurts, you try resting it, maybe you stop exercising, maybe you're worried that you're slowly damaging your joints, and somewhere in your mind, you've probably thought maybe this is just age. Here's the uncomfortable truth. Almost everything most people believe about knee pain is wrong, and some of those beliefs may actually be keeping you stuck. Myth number 1, knee pain's just part of getting older. Well, this belief sounds harmless, but it's incredibly limiting. Once pain feels inevitable, people stop looking for answers. Yes, aging increases the likelihood of changes like osteoarthritis, but here's something most people never hear. Pain and structure often do not match. And why is that? Large studies have found that individuals with clear osteoarthritis on x-rays who reported little or no pain, while others experienced significant pain despite minimal findings. That mismatch is one of the most fascinating discoveries in pain research. What this tells us is simple. Pain is influenced by far more than just wear and tear alone. Factors such as muscle strength, joint loading, inflammation, and movement tolerance all play a massive role. So the more accurate truth is this: your knees are not simply breaking down because of age. Pain is often a signal of stress, imbalance, or sensitivity, not an expiration date. Age contributes, but it rarely tells the whole story. As a matter of fact, a lot of patients that we have who were told they needed knee surgery, have intense knee pain, actually their knee does not have any arthritis. We have checked 60-year-olds, 70-year-olds, 50-year-olds who are active to sedentary. Just because the knee pain is there does not automatically mean you have osteoarthritis. But so often, doctors usually give you pain medication, take you through some PT, and then they'll do injections. And usually they're hyaluronic injections, but most of the time they're actually cortisone injections. Now, most people don't understand that cortisone injections, in fact, actually decreases the function of the knee because it eats away the tendon, ligaments, the blood vessels inside the knee, and the nerves as well. So over time, if you do have knee pain and all you do is you keep getting cortisone injections, your knee will actually end up getting worse and worse and worse over time, more accelerated because it's degrading that joint on a cellular level. A lot of people will tell me, well, Dr. Tam, that first shot, man, it was great. It lasted months or even years. But that second shot lasted significantly less, and that third shot barely worked at all. And forget about it. I'm not doing it anymore. And now, because the cortisone shot hasn't worked, they are in a lifetime of pain, especially if you're in your 40s or 50s. You're not even ready for knee surgery yet. A good surgeon will usually say, well, knee surgery only lasts about 10 to 15 years. That's what we've seen. And they won't want to do it until you're at least in your late 50s or 60s because they know it only lasts about 10 to 15 years. But a lot of times when patients have came in, they still have space left. It's not like the bones are completely eaten away and the joint, the meniscus is just gone. Those are usually the times when people need knee surgery, and when there's completely zero room, not even a sliver of room, and well, the pain has gotten so bad because you're not able to move because the joint's completely locked up. So really look at this. We've seen people with knee pain who has osteoarthritis, very advanced, but we've also seen people with severe knee pain where I look at them, I say, well, this is not coming from the knee at all. We start doing an examination. Well, where's the pain coming from? Could be coming from the calf, the patellar tendon, the IT band, hip flexor, a mountain aligned pelvis. The key is figuring out exactly where the problem is coming from. Myth number 2, if your knee hurts, you should just rest completely. This belief feels logical. Pain seems to mean stop movement, but long-term, this strategy often backfires. When your movement decreases, muscle support also decreases. You get weaker muscles, provide less protections for your joint. Now, this is where research becomes very clear. Large systematic reviews show that therapeutic exercise improves pain and function in people with knee osteoarthritis. not prolonged rest, but exercise. This is why modern clinical guidelines consistently recommend movement, strengthening, and load management as first line of care, not inactivity. The smarter strategy is not stopping everything, but adjusting the load while staying active. Think of it this way: resting calms symptoms, strength changes the outcome. So resting is usually one of the worst things you can do, is just sit there and do nothing for the knee. The knee is a joint. Imagine like a shock absorber, right? It's like the shock absorber of a car. A lot of times if your car just sits there without having that movement, then it gets worse, right? The shocks will rust and it doesn't move anymore because it doesn't have the oil to pump it back and forth. And your knee works the same way. So if you do have pain in your knee and working on it, walking on it, maybe running hurts, going up and down the stair hurts, you have to keep it moving. Don't just sit there and do nothing. A lot of times that's usually one of the worst things you can do, is sitting there and doing nothing. We recommend a lot of our patients to go walk in a pool, right? Walk in a pool where the water level is either right around belly button to chest height, so that you're able to walk back and forth and see if there's still pain. If there's less pain when you do that, or there's no pain, well, that's gonna be a good therapy for you, because movement, it's not so much the movement of the joint itself that causes pain, it's that pressure. Once you took the pressure off, wow, pain's a lot less. And now as you walk back and forth, you can actually lubricate that joint a lot better, and you're able to work the muscles a lot better. Walk backwards, walk forward, right? You can walk side to side and do crab walk, sumo walk forward, sumo walk backwards. Those are usually the 6 directions I have our patients do, and it helps a lot. Now, maybe you say, well, Dr. Tam, walking the pool is still not doable for me. Well, then the next thing you need to do is try a recumbent bike. The bike where you're sitting up and then your feet is in front of you, the pedals are in front of you, and start at almost 0 resistance and then move up from there. That would usually generate a good pumping motion. That's also really good for the knee. Sitting down with your legs up, not doing anything, if your knee hurts, swelling might go down, but a lot of times scar tissue will also build up. So it's not always the best way. Here's myth number 3. Running and exercise destroys your knees. This myth has scared countless people away from movement. But what is interesting in that research tells a very different story. Large-scale reviews examining recreational runners have found no increased risk of knee osteoarthritis compared with non-runners. In some analysis, recreational runners even show lower rates of osteoarthritis, which completely flips the common narrative. Now, a nuance matters. Poor training strategies can absolutely create problems. Too much load, progressing too quickly, and little to no recovery can all lead to issues. But the idea that impact automatically equals damage is not supported by evidence. Your knee is not a fragile piece of glass. It is a biological structure designed to adapt to load. The real problem is rarely movement itself. It is how the load is managed. Exercise is often protective. Poor progression is usually the issue. Cracking or popping means knee damage. Now I know noises of the knee can trigger instant anxiety. People often imagine bones grinding away, but the sound alone is not a diagnosis. There are many completely normal reasons for joint noise, including pressure changes, tendon movements, and gas releases. Research shows crepitus offers something a little bit more reassuring. Noise without pain, swelling, or locking instability is often not harmful by itself. It is very common and very misunderstood. Now, if popping comes with symptoms, that's completely different. The noise alone is not a disaster that most people would imagine. Your knee making sound does not automatically mean your knee is being damaged. Myth number 5. Pain always means something's torn. Well, this belief feels like an enormous fear. Pain is often interpreted as danger or damage. It doesn't mean surgery. A lot of reviews and research shows that when they look at pain-free adults, they found some meniscus tears and even individuals with 0 knee pain and completely functional knees. This is telling us something very important, that tears can exist without any pain, and pain can exist without major tears. Pain is real, but it is influenced by multiple symptoms. and systems, including joint mechanism, inflammation, nervous system sensitivity, strength deficits, and recovery capacity. This is why two people with similar MRI findings can have completely different pain experiences. Pain is not simply a damage detector. It is a protective mechanism and response shaped by many variables, which leads to much better question. Not what's torn, but what's driving the stress and sensitivity in my knee. So here's what we have to know. Knee pain is not automatically just a result of aging. Rest may help in the short run, but strength wins in the long term. Recreational running is not proven to destroy your knees. Crackling sounds do not automatically mean damage, and pain does not always match what appears on imaging. Most knee pain myths sound logical, but what is exactly happening is not always what you think. Understanding what is truly happening inside the body can change how people recover, because once fear begins to decrease, progress becomes possible. And if you're someone who has been dealing with persistent knee pain, trying different approaches without fully understanding the root cause, you can learn more about how we approach this at absoluteintegrativehealth.com.